my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is from Warnal.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, voice therapist. Can you hear me?
Video is laggy. Your video is laggy.
It has stuck, I think. 1 minute, I'll call you again. I'm going to call again once. Yeah, sorry for the technical problem. So welcome to our YouTube channel SLP Sanjay Kumar, voice therapist, and today we are live with Srikar, and Srikar is having voice problem, and today we are before treatment live, and today date is 1st June 2021, and in the future we are going to post treatment live also. So please subscribe our YouTube channel, those who are watching this, so that you can watch post treatment live of Srikar. And my name is Sanjay Kumar. By profession, I'm a speech language pathologist and audiologist. And my area of interest is treating voice disorder. And I have studied from AIIMS Delhi, All Indian Institute of Medical Science, New Delhi. I have done my graduation in the speech and hearing science, and post-graduation I have done from the University of Mysore in the field of speech language pathology. So Srikar, I want you to tell about problem, what challenges you are facing. We are live at YouTube.
Yeah, so for the past 3 years, it's been really hard for me to speak loud, especially in loud environments. I have to repeat it twice, and it's hard for people to understand me. And I also have voice cracks sometimes, and it just gets really embarrassing whenever I have voice cracks. And yeah, it's just really hard. And people have been also telling me that and asking me why my voice sounds really high-pitched and saying, oh, your voice is so squeaky, it's so abnormal. And I've been called names and made fun of, teased, and yeah.
Okay, and since how long you are facing the problem?
Since I was in 7th grade, so 3 years.
And I am in India and you are some different country. So I want to talk to your father about your problem.
Hello, doctor.
Hi. So I want you to tell about his problem in detail, and if you have tried any treatment, that also you can tell. And we'll be treating online.
Yes. So he was having these problems since he was in 7th grade. Now he's in 10th grade, almost 3 years back. We couldn't identify this problem initially, thinking that it was a puberty-related issue. We thought his voice would change, but eventually it didn't happen, and we only understood his problem after he told us that he was getting bullied in the school. He was calling names and people are teasing him. So that is when we started thinking that maybe he needs some medical help, and we consulted some doctors here in this country. So far, no luck. So we watched your YouTube videos online, and we thought we should consult you.
Okay, no problem. We'll correct this problem online by online voice therapy. Thanks for your faith on us. Okay, I'll be talking to this Srikar.
Okay, thank you so much.
Thank you. So yeah, Srikar. So tell your hobbies. I want you to speak more and more so that people can hear your voice. How you spend your time on Sunday?
I just usually watch iPad and play video games and go for a walk.
And in which class you are studying now?
I just finished 10th grade.
Okay, so this problem is called puberphonia. Okay, and by voice therapy we'll be correcting. So I'll be talking a little about of the puberphonia, why this problem occurs. Okay, so to understand the problem, let's first understand how the normal speech production mechanism is. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put a air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar sounds, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. And once we say one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound. So it is little complex process. In this process, there are hundreds of our body muscles works in a very coordinated way. So why the puberphonia is? So why your voice is still childish, or we can say high pitch voice. When I did the acoustic analysis, perceptual evaluation, all showing that it's a very high pitch voice. So during puberty, due to a hormone called testosterone, mass of the vocal cord, length of the vocal cord increases and pitch reduces. So before puberty, there is no much difference between male and the female's vocal cord. But in case of males, in case of boys, the vocal cord mass and length increases due to the hormone called testosterone. So if vocal cord mass will be more, the pitch will be low. It will be more masculine. You can compare your vocal cord like a guitar string to understand this problem. Before puberty, our vocal cords, or in case of boys, the vocal cords are like a thin string of a guitar. During puberty, because of the testosterone effect, mass of the vocal cord increases and length of the vocal cord increases. So it becomes thick string of a guitar-like structure. So when the guitar string will be thin, pitch will be higher. So that happens before puberty. But after puberty, the vocal cords become thick. So means it behaves like a thick string of a guitar. So the pitch should be lower, which happen in most people. But in your case, what has happened, from childhood to puberty, you spoke in a high pitch voice. And during puberty, mass got changed, means vocal cord mass got changed, length got changed. So now your vocal cord was ready to produce the low pitch voice. But because of your last so many years habit, we can say 12, 13 years of habit in talking in a high pitch voice, you didn't accept the change which has happened during the puberty. Means your vocal cord was ready to produce the low pitch voice, but because of your 12, 13 years habit, you have not shifted to the new voice. So to maintain your childish voice, what you did, like vocal cord mass got increased, length got increased, but to maintain your childish voice, you were not vibrating whole mass and the whole length of the vocal cord. We are only vibrating thin edges of the vocal cord. So if thin edges you are vibrating, so vocal cord which was actually thick but behaving like a thin string of a guitar. And if guitar string will be thin, the pitch will be higher. So what I will do as a voice therapist, I will stimulate whole mass and the whole length of the vocal cord with certain vocal exercise we called voice therapy. And once whole mass in the whole lymph will be stimulated, so earlier the vocal cord thin edges were vibrating, now whole mass will start vibrating. So whole mass will start vibrating, so the vocal cord which was behaving like a thin string of a guitar, now it will start behave like a thick string of a guitar, so the pitch will reduce. And this is the way what we are going to do, and I'm very much confident we'll correct your problem. And thanks for your faith on us. And at the same time, I'll be just seeing that if any questions are there for my YouTube channel viewers, so I'll be trying to give answer. You can be online. So hello friends, I can read your questions, and those who are watching this live, I want to tell thank you everyone. And here is the general gamer somebody, and Sadanand Pandey, Srinivas, and thank you everyone for joining and watching us. And Sadanand Pandey is telling sir, stammering है हमें सर. तो सदानंद पांडे जी, मैं कहना चाहूँगा कि स्टैमरिंग के केस में भी स्पीच थेरेपी के माध्यम से इम्प्रूवमेंट देखा गया है, और मैंने अपनी क्लिनिक में ऑब्जर्व किया है कि स्टैमरिंग के केस में 80% ट्रीटमेंट एफिकेसी है. कहने का मतलब 100 लोग मेरे क्लिनिक में आते हैं तो 80 लोगों को फ़ायदा होता है, तो 80-20 से ज़्यादा है तो उम्मीद ज़्यादा है. लेकिन स्टैमरिंग का 100% क्योर नहीं होता है. कुछ झोला छाप काइंड ऑफ लोग जो हैं वो गारंटी लेते हैं, लेकिन हम लोग इससे सहमत नहीं है कि 100% क्योर होगा स्टैमरिंग का. तो आप हमें कॉल कीजिए, हमारा कॉन्टैक्ट डिटेल है हमारे वेबसाइट पे www.speechtherapieindia.in, और फिर रीच मी क्लिक कीजिए और हमें कॉन्टैक्ट कीजिए, फिर हम आपको हेल्प कर पाएंगे. सदानंद पांडे. और श्रीनिवास जी लिखते हैं हाय सर. हाय श्रीनिवास. सदानंद पांडे लिखते हैं हमें कहाँ आना होगा. तो हमारे वेबसाइट पे क्लिक कीजिए www.speechtherapyindia.in, फिर क्लिक कीजिए रीच मी, हमारा कॉन्टैक्ट डिटेल मिलेगा और आप कॉन्टैक्ट कर सकते हैं वहाँ पे. और तीनों तरह लिखते हैं आई हैव नो एनी प्रॉब्लम, आई वांट मोर लाउडली स्पीक. सो आई वांट टू तीनों I want to do the perceptual evaluation, and if needed we will suggest some test and then accordingly we'll guide you. So please call us, and our contact details you'll be able to find at our website. And Pradeep Karan is like, I need your help sir, my voice is also high pitched voice. So Pradeep Karan, same suggestion is for you. Please click our website www.speechtherapyindia.in, then click the reach me, you'll find the contact details and you can communicate with us. We'll do the perceptual evaluation. If needed, we'll suggest some tests, and depending upon that, we'll be able to guide you. And Shiva Chaturvedi is saying, hello, sir. Hello, Shiva Chaturvedi. If you have any question, feel free to ask. We'll be discussing with you all. And those who have joined newly, I want to inform, with us today is Srikar. And Srikar is not in India, he's in different country. And he tried some therapy, but somehow it was not helpful. So he is going to take therapy from us, and we'll be giving online voice therapy. So Srikar, can you tell your problem again? Maybe some new viewers are watching this live, so they should understand what exactly problem you are facing. Please describe your problem.
So basically for the last 3 years, it's hard for me to speak very loud, and it's I have to repeat something more than once and multiple times for people to understand me sometimes, especially in loud environments, such as a temple or like a party. Also, people have been saying and asking me why my voice sounds very squeaky, not normal. And I've also been called names and teased a lot in school and stuff. And it's also hard for me to sometimes sing, and it hurts my throat when I do for too long. And yeah.
Okay, so thank you for your faith. In spite of staying in different country, you have shown faith on us, and we'll correct this problem, don't worry. And those who are watching this live, please subscribe our YouTube channel, and don't forget to watch Srikar post treatment live. And now I'll be coming, there are some questions. So Manas, hello sir, he's writing, thanks. Hello Manas. And Mr. Devendra Chaudhary is writing, hello sir, मेरी voice भी गर्ल जैसी है, तेज नहीं बोल पा रहा हूँ. तो देवेंद्र चौधरी, आपके लिए भी यही सजेशन है कि आप हमें कॉल कीजिए, और इस लाइव जो वीडियो है इसके डिस्क्रिप्शन में भी हमारा कॉन्टैक्ट डिटेल मिल जाएगा. हम आपकी आवाज़ सुनेंगे, समझेंगे, फिर अकॉर्डिंगली गाइड कर पाएंगे. हो सकता है तो कुछ टेस्ट के लिए रिकमेंड करें, और हो सकता है तो ना भी करें. तो पहला स्टेज होगा परसेप्चुअल एवोल्यूशन, फिर हम गाइड कर पाएंगे. और मानस वही लिखते हैं, हाय सर, हाय मानस। मिस्टर देवेंद्र चौधरी लिखते हैं, हेलो सर, मेरी वॉइस भी गर्ल जैसी है एंड तेज नहीं बोल पा रहा हूँ। ठीक है, आप हमें कॉल कीजिए, हम आपका परसेप्चुअल एवोल्यूशन करेंगे। और सुनील वर्मा लिखते हैं, मुझे भी यही प्रॉब्लम है। ठीक है सुनील जी, आप हमें कॉल कीजिए, हम परसेप्चुअल एवोल्यूशन के बाद आपको गाइड कर पाएंगे। एटलीस्ट हो सकता है तो कुछ टेस्ट भी रिकमेंड कर सकते हैं। और चंदन लिखते हैं, सर मुझे वोकल कॉर्ड पैरालिसिस है, मैं आपसे कांटेक्ट करना चाहता हूं। तो चंदन जी, वोकल कॉर्ड पैरालिसिस के केस में भी हमने वॉइस थेरेपी दिया है, इनफैक्ट ऑनलाइन वॉइस थेरेपी भी दिया है और इम्प्रूवमेंट अच्छा खासा देखा गया है। तो हमारे वेबसाइट पे जाइए, क्लिक कीजिए, रीच मी हमारा वेबसाइट है www.speechtherapyindia.in, वहाँ पे क्लिक कीजिए रीच मी, हमारा ईमेल आईडी मिलेगा, हमारा फ़ोन नंबर मिलेगा और गूगल मैप पे हमारा क्लिनिक कहाँ पे सिचुएटेड है वो एड्रेस भी दिखेगा। तो आप हमारे से कांटेक्ट कीजिए किसी भी माध्यम से और हम आप लोगों को हेल्प कर पाएंगे परसेप्चुअल इवोल्यूशन के बाद। और थैंक यू एवरीवन फॉर वाचिंग। एंड जो लोग भी पहली बार अगर हमारे यूट्यूब चैनल से जुड़े हैं तो उनके लिए सजेशन ये है कि हमारे बारे में ज़्यादा समझने के लिए हमारे यूट्यूब चैनल की प्लेलिस्ट को एक्सप्लोर कीजिए। जब आप एक्सप्लोर करेंगे तो डिफरेंट कम्युनिकेशन डिसऑर्डर के प्री एंड पोस्ट ट्रीटमेंट वीडियोस दिखेंगे। उससे आपको ये पता चलेगा कि एक सर्टिफाइड स्पीच लैंग्वेज पैथोलॉजिस्ट जो होते हैं लोगों की लाइफ को कैसे बदल देते हैं कम्युनिकेशन डिसऑर्डर के प्रॉब्लम को सॉल्व करके। So those who are joined newly, my suggestion is you can explore our YouTube channel's playlist, and once you'll explore our YouTube channel playlist, you will able to find that how a certified speech language pathologist can change the life of people having the communication disorder. So when you'll explore the playlist of YouTube channel, you may find vocal cord paralysis pre-post treatment videos, you will find puberphonia pre-post treatment videos, you will find high pitch voice pre-post treatment video, you will find the phonetics gap pre-post treatment video, you will find sulcus vocalis playlist, you will find functional aphonia playlist, and you will find stroke patients playlist before and after treatment, and you will find misarticulation pronunciation problem pre and post treatment videos. So my suggestion is you try to explore, even you will find spasmodic dysphonia pre and post treatment videos. So that will help you to understand how the speech pathologist helps the people non-surgically. And many people think that like pitch correction and loudness correction at more age, older age is not possible by the voice therapy. But here I am not agree. We have treated pitch problem at 55 years age also patient, 39 years age also patients. So of course the voice therapy help at the higher age also. So first thing, you should try the voice therapy. If it doesn't work, then you should think about the surgery and other procedure. And I can see some more question. Manas is or Himal Karki. Thank you, Manas, for recommending us. Thank you so much. And Himal Karki writing how to control stammering. The Himal Karki, by speech therapy, it will help, and you can try speech therapy in case of stammering also. And Mr. Devin Chaudhary is saying, सर मैंने 4-5 बड़े हॉस्पिटल में दिखाया था, बहुत नहीं हो रहा है सर। ठीक, अभी मैं तमिलनाडु में हूँ सर, मैं आपके वहाँ नहीं आ सकता क्योंकि मेरी एज उतनी ही नहीं है सर कि मैं ट्रैवल कर सकूं। तो मिस्टर देवेंद्र चौधरी, आपके लिए ये सजेशन ये है कि आप हमें कॉल कीजिए। हमारा जो कॉन्टैक्ट डिटेल है हमारे वेबसाइट पे है www.speechtherapyindia.in, और हम आपकी आवाज़ सुनेंगे, समझेंगे, फिर डिसाइड करेंगे आप ऑनलाइन ट्रीटमेंट के लिए कैंडिडेट सुटेबल हैं या ऑफलाइन ट्रीटमेंट के लिए, या फिर कुछ टेस्ट की ज़रूरत पड़ेगी, फिर हम लोग रिकमेंड कर पाएंगे। ठीक है। एंड तो हम सारे लोगों को ऑफलाइन ट्रीटमेंट के लिए या सारे लोगों को ऑनलाइन ट्रीटमेंट के लिए हम सजेस्ट नहीं कर पा रहे हैं अभी पैंडेमिक की वजह से। तो पहले हम परसेप्चुअल इवोल्यूशन करेंगे, फिर अकॉर्डिंगली गाइड कर पाएंगे। सो थैंक यू एवरीवन फॉर ज्वाइनिंग अस एंड watching us, and if any more question will be there, we'll be keep discussing. And yeah, so before that, Srikar, you can again show your voice sample like what exactly problem you are facing and since how long you are facing. Srikar.
3 years.
Yeah, since how long you are facing the problem and what problem you are facing?
3 years.
Can you hear me?
Uh,
Can you hear me?
yeah, I can hear you.
Yeah. So I want you to tell again what exactly problem you are facing. Maybe you have spoken earlier, but I want you to repeat again. There are some new viewers at our YouTube channel.
I'm facing puberphonia.
Yeah, you can describe your day-to-day life challenges. What challenges you are facing?
So, for the past 3 years, it's hard for me to speak loud. My voice has been like this, and people have been saying it sounds squeaky and unusual, that I speak like a girl, and calling me names tease me. And it's also hard for me to sing as well. It just hurts my throat when I do it for too long.
Okay, so I want to talk to your father again a few minutes. He's here. Please call.
Hello, doctor.
हाँ सर, तो एक बार फिर से just you can tell about his problem so people can understand what exactly the problem he's facing.
Yeah, so for last 3 years, when his voice is very squeaky and he's not able to speak loud, we have to ask him to repeat because we couldn't hear him. But later we found out that it is becoming a big problem in school, as well as teachers couldn't hear, his friends couldn't hear what he's saying, and some of his friends started teasing him. So that is when we thought maybe he needs some kind of medical help. So we contacted some of doctors here, but not a positive result so far. So we thought of talking to, we did some research online and we found your videos and we really wanted to try this therapy and we're really hopeful on this.
Okay, in spite of being in different country and I'm in India and Bangalore and you are in different country, you have shown faith in us and we'll correct this problem.
Okay, thank you so much.
Thank you. So if those who are having, thank you. So if any question will there, I'll be discussing again. The Chandan Bagdi is saying, sir, online treatment करना चाहता हूँ. So चंदन जी, online treatment के लिए सारे लोग suitable नहीं होते हैं. तो हम उनका evaluation करते हैं. एक perceptual evaluation होता है. पहले सुन के समझते हैं प्रॉब्लम को, फिर ज़रूरत पड़ती है तो कुछ टेस्ट रिकमेंड करते हैं, फिर हम लोग डिसाइड करते हैं कि आप ऑनलाइन के लिए सुटेबल कैंडिडेट हैं या नहीं हैं. तो चंदन जी, आप हमें कॉल कीजिए और हमारा कॉन्टैक्ट डिटेल इस लाइव वीडियो के डिस्क्रिप्शन में भी मिलेगा और हमारे वेबसाइट पे भी है. तो थैंक यू चंदन जी फॉर आस्किंग क्वेश्चन एंड आई वांट टू थैंक यू एवरीवन दोज हु हैव जॉइन्ड दिस लाइव. जनरल गेमर, संदीप पांडे, श्रीनिवास कंडगला, सदानंद पांडे एंड तीनू तरल, प्रदीप कर्ण, सुनील वर्मा, शिवा चतुर्वेदी, मानस भोई, अमंद पासवान एंड अमन पासवान का क्वेश्चन है, सर प्यूबरफोनिया के इलाज में कितना स्पीच थेरेपी करना पड़ता है? तो अमन पासवान जी, आप हमें कॉल कीजिए और हम पहले आपकी आवाज़ को सुनेंगे, समझेंगे, फिर अकॉर्डिंगली आपके बारे में गाइड कर पाएंगे. लेकिन कई बार होता है कि डिफरेंट कम्युनिकेशन डिसऑर्डर में ट्रीटमेंट ड्यूरेशन डिफरेंट होता है. तो एक बेसिक जो है इवैल्यूएशन के बाद ही हम कमेंट कर पाएंगे. और मिस्टर देवेंद्र चौधरी, श्रवण कुमार बोदुलू एंड थैंक यू एवरीवन फॉर ज्वाइनिंग एंड वाचिंग अस. सुनील वर्मा, मुझे भी यही प्रॉब्लम है, तो सुनील जी आप हमें कांटेक्ट कर सकते हैं. और साहिल लिखते हैं कि खाली फेस 6 के फ़ायदा और मुस्कान बताइए. समझ नहीं पा रहा हूँ साहिल जी आपके क्वेश्चन. और नीतीश कुमार लिखते हैं, सर हाउ टू कांटेक्ट यू. तो नीतीश जी आप हमारे वेबसाइट पे जाइए. हमारा वेबसाइट है www.speechtherapyindia.in. क्लिक कीजिए रीच मी, वहाँ पे हमारा कांटेक्ट डिटेल मिलेगा. आप हमें ईमेल कर सकते हैं, अपना फ़ोन नंबर मेल के माध्यम से हमें भेज सकते हैं. और आप हमें फिज़िकली क्लिनिक पे पहुँच सकते हैं ये पैंडेमिक के बाद. और जब कर्नाटका में जो है वो लॉकडाउन चल रहा है, वो ओपन होगा तो हमारा क्लिनिक भी ओपन होगा, और फिर आप हमें मेल कर सकते हैं, कॉल कर सकते हैं, क्लिनिक में भी आ सकते हैं। शिवा चतुर्वेदी जी लिखते हैं, सर प्लीज़ हेल्प मी नाउ, आई एम ए डिफेंस एस्पिरेंट बट माई पिच इज़ वेरी हाई एंड आई एम नॉट एबल टू बूस्ट माई कॉन्फिडेंस विद दिस वॉइस। तो शिवा चतुर्वेदी, please call us for perceptual evaluation, and I feel that voice therapy may help you, but before that I want to do the perceptual evaluation. So thank you everyone for watching, joining us and asking question. Thank you all, love you all. If more question will be there, we'll continue, otherwise we'll stop this live. So साहिल लिखते हैं, सर खाली फोसिक्स एक होम्योपैथी मेडिसिन है, उसका फ़ायदा और नुकसान बताइए। साहिल जी, आप कुछ आज मेरे बारे में जानने में थोड़ी सी जो है गलतफहमी हो गई। मैं होम्योपैथी डॉक्टर नहीं हूँ, मैं एक स्पीच लैंग्वेज पैथोलॉजिस्ट हूँ, स्पीच थेरेपिस्ट हूँ। मैं विदाउट मेडिसिन, विदाउट सर्जरी, वॉइस थेरेपी के माध्यम से प्रॉब्लम को करेक्ट करता हूँ। तो मेडिसिन से रिलेटेड जो इश्यूज़ हैं और जिस भी फील्ड के मेडिसिन है, आप उनसे रिलेटेड जो है एक्सपर्ट, उनसे आप पूछ सकते हैं। तो मुझे नहीं लगता है कि ये क्वेश्चन आप क्या लिख रहे हैं साहिल, और यहाँ के लिए वो सुटेबल भी नहीं है, तो ठीक है। और तो यहाँ पे हम लोग वॉइस थेरेपी की चर्चा करेंगे। मेरी ट्रेनिंग सर्जरी में नहीं है, मेरी ट्रेनिंग मेडिसिन पे भी नहीं है, तो मेडिसिन सर्जरी की बात ज़्यादा नहीं कर पाएंगे, हम लोग वॉइस थेरेपी की बात करेंगे। और मैं अपने बारे में फिर से रिपीट कर देता हूँ, मैं क्या हूँ। बाय प्रोफेशन मैं स्पीच लैंग्वेज पैथोलॉजिस्ट हूँ, स्पीच थेरेपिस्ट हूँ, ऑडियोलॉजिस्ट हूँ, और मैंने अपनी पढ़ाई की है एम्स दिल्ली से, ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंस न्यू दिल्ली से ग्रेजुएशन किया है। पोस्ट ग्रेजुएशन किया है मैंने स्पीच लैंग्वेज पैथोलॉजी फील्ड में यूनिवर्सिटी ऑफ मैसूर से, और मेरा एरिया ऑफ इंटरेस्ट है वॉइस डिसऑर्डर का ट्रीटमेंट करना। सो अबाउट मी, आई एम ए प्रोफेशनल trained in communication disorder, and I am a speech language pathologist, audiologist and speech therapist. I have studied from AIIMS Delhi. I have done graduation from there, and post graduation I have done from the University of Mysore in the field of speech language pathology, and from AIIMS Delhi I have done my graduation in speech and hearing science. So I can talk about more about the speech and hearing problem instead of talking more medicine and surgery. And so Siva Chaturvedi is saying, call pick आप ही करेंगे क्या? हमारी टीम या हम जो भी फ्री होंगे करेंगे, लेकिन जब हम थेरेपी में रहते हैं तो नहीं कर पाते, लेकिन ज़्यादातर हमारी टीम ही कॉल पिक करती है, और कई बार वो अगर बिजी रही तो मैं भी कर लेता हूँ। तो हम लोग तो शिवा चतुर्वेदी जी, आप हमारे वेबसाइट पे जाइए www.speechtherapyindia.in, हमारा कॉन्टैक्ट डिटेल मिलेगा। So thank you everyone for joining us, and I think we can stop this live, and if any specific questions will be there, we'll discuss. Yeah, I'm getting some more question. मेरे को पियरफोनिया है, सम गफूर लिखते हैं, मेरे को पियरफोनिया है, क्या करूं? बोलने में प्रॉब्लम होती है, ऑनलाइन क्लास भी अटेंड नहीं कर पाता हूं। तो गफूर जी, आप हमारे वेबसाइट पे जाइए www.speechtherapyindia.in, क्लिक कीजिए रीच मी, और वहाँ पे हमारा ईमेल आईडी मिलेगा। फिर आप हमें मेल कीजिए, और इस मेल में अपना कॉन्टैक्ट नंबर भी भेज दीजिए, क्योंकि क्लिनिक हमारा क्लोज है, तो क्लिनिक में कोई फ़ोन नहीं उठाएगा, मैं बता देना चाहता हूँ। मोस्ट प्रोबेबली 6 जून या 7 जून के बाद हम लोग उठा पाएंगे, अगर सब कुछ सही रहा तो। अभी कोई नहीं उठा पाएगा, क्लिनिक क्लोज है, लेकिन आप हमें मेल करके अपना कॉन्टैक्ट नंबर दीजिए, हम लोग कॉन्टैक्ट करेंगे। और थैंक यू एवरीवन फॉर ज्वाइनिंग एंड वाचिंग। आई थिंक और हमारे बारे में ज़्यादा जानकारी मिल सकती है हमारे वेबसाइट पे www.speechtherapyindia.in। हमारे क्लिनिक का नाम है संजय स्पीच हियरिंग एंड रिहैबिलिटेशन सेंटर, जो कि बैंगलोर में है। तो आप लोग आ सकते हैं हमारे क्लिनिक में। और ठीक है, so I think Srikar, we'll stop this live. Our plan was near about 15 minutes, so we are going to complete 15 minutes. So Srikar, once you tell your hobbies, you can tell, so that people can hear your voice again. What are your hobbies?
My hobbies are biking and playing iPad and hanging out with friends.
So how you spend your time on Sunday?
I usually either go for a walk or just watch TV and play video games.
Okay, so in Bangalore it's raining, so I think some background noise may be coming. So sorry for that. And so thank you everyone for joining us and watching us. Thank you so much. Thank you so much. We can stop this live. And please subscribe our YouTube channel, those who are watching this live, and don't forget to watch Srikar post-treatment live. So we'll be doing in future. Thank you everyone for joining.